Okay.
So good evening and welcome to all. I welcome on the behalf of Sexual Medicine Committee with our fourth episode of this series, this psychosexual health. So today we are here again with a very interesting topic, that is the sex therapy. So before we start our session for today, I would like to invite the person behind all this program, our own chairperson, Dr. Neeraj Jadhav, sir. Sir doesn't need any introduction. Sir is our chairperson and at present the Vice President Menopause Society Rajkot. Over to you, Neeraj sir, for the briefing about all this program.
Hello. Good evening and welcome to today's fourth session of Masterclass series in psychosexual health. This is our fourth session. Previously, we did three sessions. First one was on communication. Second one was on sensate focus. And third one was on CBT, cognitive behavioral therapy. And this is our fourth session that is on sex therapy. So sex therapy can help people identify and work through their sexual challenges such as low sexual drive, pain during sex, or difficulty having an orgasm. It can help improve the sexual satisfaction. Sex therapy may benefit anyone who wants to improve the relation with sex and pleasure. It can be especially helpful for those who have a difficulty with lack of arousal, painful intercourse, and inability to have orgasm, and other as well as many other sexual dysfunction. You all know that sex therapy is a type of talk therapy designed to help individuals and couples experiencing issue achieving the sexual satisfaction. Physical, psychological, and emotional factor can all cause sexual challenges. A sex therapist's goal is to help person or couple to address this issue and obtain more fulfilling sex life. So this is I welcome everyone once again to this post session, and I hope this will be very beneficial to you in your day-to-day practice, because we as a gynecologist are not that much familiar with the psychotherapy, and this sex therapy knowledge will help us to manage our patient with the sexual dysfunctions. So welcome everyone, and happy learning to everyone. Over to you, Apurva.
Thank you. Thank you so much, sir, for bringing out this very important topic, a very important underrated topic, I should say, because we gynecologists have little or no idea about this topic. So thank you, sir. So as we know in our culture, whenever we start something new, something different, we are always taking the blessings from our senior. So today, to bless us, we have a very, very special guest with us, a person who is loved by every Foxian, everyone. And for me, he is my godfather, and he bring out and he inspired me what I am today. The person, none other than but our own Alpesh Gandhi, sir. Sir doesn't need any introduction. Sir is the past president of Foxy, past vice president Foxy, and what not. Sir is always there for everybody, especially the youngsters. And I just ये ज्यादा नहीं होगा, but he bring out at least 100 young Foxian from different part of India, and those are really doing wonderful in their field. So sir, you are always an inspiration for all of us. Over to you, sir, for your kind words. Alpesh sir.
Welcome, Alpesh sir. And sir is the when this all webinar started, because of the corona, sir was president of Foxy, and due to
Absolutely.
problem of physical gathering was not allowed, webinar was started, and we have a great work under Dr. Alpesh Gandhi sir. So welcome, sir.
Thank you. Thank you, Dr. Neeraj. We really enjoyed working together during my tenure. Thank you, Apurva, for the kind words. You informed about youngsters across India, but I am also young, and
Absolutely, sir.
And I can see your future, bright future, more than me, what I have achieved in Foxy.
Sir, sir, sir.
So
Thank you so much,
it's
sir.
good
Sir,
to
you are
have
all.
you all youngsters work. It's good to see all youngsters working for Foxy, and Foxy is fortunate that now I think next 15, 20 years, we have a bright future and great leadership from all of you. Dr. Rishikesh Pai, Foxy's president, a dynamic Secretary General, Dr. Madhuri Patel, a vibrant Vice President, Dr. Asa Bakshi, today's guest of honor, my very, very dear friend, Dr. Parag Biniwale, and a great academician, Dr. Ashok Kumar, Dr. T.S.S. Rao, our faculty, we have no words for sir. We have learned a lot from him, and we can say he is the authority of this all topic subjects, and it's good that Dr. Neeraj has identified such a good faculty, eminent faculty for all of us, and he has invited him for so many times, so we all can be benefited from sir's knowledge. During my tenure also, I got many opportunity to interact with him. So sir, we all are very benefited from your expertise, knowledge, and tips. At the beginning, I would like to congratulate Dr. Neeraj, who has made this difficult topic, which is very interested topic, but somehow it was not so highlighted or not so much discussed, and he has really give a place to this very, very important topic, which this topic required. So congratulations, Dr. Neeraj, for making this committee very interesting, vibrant, and I can see a lot of competition for this committee in future also. So this is really important to make others to take leadership of your committee. So that is also one achievement. Regarding the topic, sexuality is an important aspect of health which can impact the overall well-being of men and women. Disorders of sexual functioning are common among men and women of all ages. The incidence is very high, but of course, as we have discussed, it is less discussed. Even sufferers are also not coming, and because of various reasons, maybe because of cultural backgrounds, or maybe because of some shyness, or maybe so many other reasons, or may not be accessibility, may not having knowledge where to go for this. But it's a less research public health issue in India. This is, in my understanding, in my view, this is a public health issue. So this is very important for all of us to have basic knowledge for this topic, this subject. Sex therapy is an integrative approach to treating and eliminating underlying challenges. And there are so many underlying challenges. Sex therapy can help individuals and couples find a way to have open, honest communication so that they can work through any concerns or challenges towards a healthy, happy sex life. The goal of sex therapy is to help people move past physical and emotional challenges to have a satisfying relationship and pleasurable sex life. And if we want, and that is why we should learn this topic thoroughly. And that is why I would request all the delegates. I can see a great number of delegates attending this webinar, but still I would like to request all of you to regularly attending this webinar and to pass on this message to all your friends, all your society members also, to join this webinar in a big number, large number, so that the hard work done by Dr. Neeraj and committee members will definitely be more and more useful to all of us. Actually, I would, as per my opinion, this should be included even in the curriculum of undergraduates also, and proper training is very, very required, very important from the undergraduation itself. So wider recognition of this issue is needed among the health, not only among the caretaker like us for healthcare providers, but also in policy makers also. So I think in next few years, we will have this all aspects, this apart from the academic aspects, social aspects, policy making aspects, all will also take care of this sex therapy and sexual medicine, sexual health of city of our members of and all the citizens of India also. So with this, I once again would like to congratulate Dr. Neeraj, his team, Dr. Apurva, Dr. Manish, all are working very hard. So congratulations to all of you and best wishes for the success of this webinar. Thank you very much.
Thank you, sir.
Thank you. Thank you so much, sir.
Thank you, sir. I would like to invite Dr. Madhuri Patel, Madam, Secretary General, FOXI, to say a few words regarding this particular event. Welcome, ma'am.
Yeah, thank you, Dr. Manish, for your kind words. Respected our chief guest, Dr. Alpesh, my friend and your past president, FOXI. Then we have Dr. Parag as a guest of honor, very dear friend to me, whom I know since last 2 decades. Then, of course, Dr. Ashok Kumar, we are working together in ICOG. Then I cannot forget Dr. Asha Bakshi, and he makes the lecture so nice that we are always there, hearing him all the time, So he gives some ornament to his talk, everything. And so Dr. Rao, I'm really enjoy your lectures. And of course, all dear delegates, very good evening to all of you. At the outset, I would like to thank the organizer for giving me this opportunity. And I cannot forget Dr. Rishikesh. Did Dr. Rishikesh has joined? No.
Yep.
He's our most vibrant, I will say most dynamic president, FOXI and visionary. And, as we have already mentioned that, this branch is such that, we all are, worried. The patients are also not, coming out because they are the passive, our women are passive partner, and they feel that coming out with such things is very, difficult. But nowadays with the education, can you hear me? Nowadays with the education of the
Yes,
women,
ma'am.
hear me?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yes, education of our girls, and they are coming out and asking us directly about this problem. And as Dr. Alpesh Bhai has said, that this is not there in any of the curriculum of our medical textbook, but it is realized, we are all realizing that this will be one of the basic medical curriculum, and that will really help our doctors to know what are the problems we all face. Now, I would not like to say much more because Dr. Rao is already there, but since there are many people, our FOXI have joined,
Voice is breaking, madam.
I think, that is the main thing. Ma'am, Madhuri ma'am, I think, no, I think she's got disconnected.
Yes, no problem. Yeah, go ahead further.
Okay. Asha ma'am is stuck in some emergency, so yeah.
Cyclone
So
effect.
she's
Madhuri
there.
madam, you want to say
Neeraj,
it? Yes,
Neeraj, I
madam.
wanted to give a last
Asa, yeah,
message.
yeah.
Yes, madam.
Our election process has started. Nominations are over. Consent form has been sent, and we are waiting 20th June to receive the consent form. And our election will be starting from August 1st. And therefore, since all our Foxian have joined, I would like to give them message that please, please update your data as far as the mobile number is concerned and as far as your email ID is concerned, because we'll be sending on both the things, the election link. Because last time I have seen that the mobile and the email ID are wrong, so they were not receiving the link. So now, today you must have received one message from Foxy or
Yes,
that
ma'am.
SMS that
Yeah.
you update your data. We'll be sending again after a week and then twice a week, later on for 2 weeks. And then we will block our system by 16th of July. If you send after 16th of July, we will not in a position to do any changes. So this and all my dear friends, please update your data because we have a 2 portal system. One you can do yourself, that is on member.foxy.org, and if you can't do it, please send us the email, we'll do it. So this is the most sincere request to all of you. Thank you very much for giving me this opportunity on this platform. Thank you very much.
Thank you, Madhuri madam.
Thank you.
you, ma'am.
Thank you so much, ma'am. Your blessings are always with us. So thank you so much.
I think
Always your
Apurva
kind
is
words.
excited to hear this, I think, because he's one of
Yes.
the contestants. Okay, okay.
Thank you. Thank you so much. Thank you, ma'am. Yes, ma'am. So after the blessings of our Secretary General, Dr. Madhuri Patel, now I would like to invite the guest of honor for today, Dr. Parag Bhinewale, sir. About Parag, sir, we gynecologists are always used to say beauty with brain. But for the Parag, sir, he is handsome with brain. So this word I can use for him. Sir is a very good a senior, a mentor, a guide for me. Sir doesn't need any introduction at present. He is the vice chairperson of the ICOG, the immediate past president of the Pune OG Society and whatnot. So thank you so much, sir, for always being with us, for always your blessing. Over to you, sir. for your
Apurva,
kind words.
Apurva,
Yes, sir.
one more introduction.
Sir.
Parag was committee chairperson, Young Talent Promotion Committee. He has worked for all the segments. He is also advisor of Midlife Committee.
Absolutely, sir.
Thank you, Apurva, for those kind words. Good evening. I bring greetings from ICOG, and at the outset, let me thank Dr. Neeraj Jadhav, who's the chairperson of the Sexual Health Committee. Pleasure to be sharing a virtual dais with a very dear friend, Dr. Alpesh Gandhi, Secretary General Dr. Madhuri Patel, and of course, Dr. Ashok Kumar, who's our dynamic Secretary of ICOG. First of all, Neeraj, I must compliment you for starting this series because somehow we gynecologists are really weak in this particular section, and then we really fail to understand so many things. So when you have speakers like Dr. Rao, it is really easy for us to understand what is going on. So, we may not be able to treat, but then we at least are in a position to guide the patient to the right person. I want to compliment you also for excellent conduct of the ICOG certification course on sexual medicine, which was attended by 1,000+ people. And I must compliment your team also. I can see Apurva, I can see Manish, whom I know since his student
Madan.
days, and of course Madan. So, it was one of the largest attended ICOG certification course. So this is something which is really interesting, and you won't believe we've received rave reviews about this, and people would be interested in continuing this particular activity. So, in the years to come, 2 years down the line, I'll be chairman of ICOG. So start preparing for a 3-day program. Maybe we'll have an extended one, and hopefully Apu will be in chair by then. So once again, thank you very much for giving me an opportunity to be here. My best wishes to the board.
Thank you. Thank you.
Thank you. Thank you so much, Parag, sir. Thank you so much. Next is Dr. Ashok Kumar sir. Sir is a great academician and definitely encyclopedia in himself. So, and he is at present the Secretary General of the ICOG, and certification course is started, in the leadership of Lakshmi ma'am, Parag sir, and our Ashok Kumar sir. So thank you so much, sir, for starting this wonderful program. And thank you so much for your valuable time for today's webinar. Over to you, sir, for your kind words and your blessings. Ashok, sir.
Thank you, Dr. Apurva. Our dear President Foxy, Dr. Pai, Secretary General Dr. Madhuri Patel, our Chief Guest Dr. Alpesh Gandhi, and Vice President Dr. Asha Rani, my dear friend Dr. Parag Biniwale, and Dr. Neeraj Yadav, the Chairman of Sexual Medicine Committee, and Program Coordinator Dr. Apurva Datta and Dr. Manish. Thank you for giving me this opportunity to be with you here on this platform. And this series, master series on psychosexual health, actually it is a very important topic. And we have great faculty, as I understand, Dr. TSS Rao, to discuss this topic on sex therapy. This topic is a very uncommon topic and need of the hour, that sex education and these sexual medicine being discussed among ourselves as well as in the community. As Dr. Alpesh Gandhi has already emphasized, that it is a issue, public health issue, and we all have to have awareness about this issue in journal. So we say in our common language that आइए भाइयों बहनों इस पर बात करें, चर्चा करें. So it is a very important thing. Sex education, again, we all know from the young age we should be discussing, but there are some disbelief, myth about all these issues, and I hope under the leadership of Dr. Neeraj Yadav and probably, and I wish Dr. Apurva Datta for his all future endeavor in Foxy, these issues will be discussed on a wider platform. This is what we expect. And probably he has done the beginning itself under his tenure, but a lot needs to be done. And as Dr. Parag Biniwala has given some hint about his activities and what his expectations in his tenure. So I hope that we will be having much more discussion on these hush-hush topic which are not being discussed and disclosed in the general public and general community as a whole. So I wish all the delegates and the audience a best learning, and I hope they will get benefit from this webinar today. So thank you, Dr. Neeraj Yadav, for organizing such type of program. Thank you very much.
Thank you.
Thank you. Thank you so much, sir, for your kind words. Your blessings are always with us. Thank you so much for always with us. And now it's the time to introduce our faculty. I would like to invite my co-moderator, Manish sir. Please invite our faculty and to start the program.
Welcome, Dr. TSS Rao, sir. And we on behalf of Foxy Sexual Medicine Committee, thank you for conducting this particular series. We already have benefited from the last three important this master class, and today is the fourth out of it. We already are getting positive reviews about the last classes, and we are hoping again to have a new enlightenment about the topic. So Dr. TSS Rao sir is a professor at JSS University and Medical College, Mysore, and he's a great teacher and mentor. And I would request sir to just proceed with the presentation.
Yeah, delegate are waiting for sir to start. So welcome, sir, and thank you for giving us time, because I know you are so busy nowadays. So thank you, sir.
Seen?
Yes, sir.
Yes, sir. Presentation is seen.
Yes, sir.
Sir, if you can minimize the side window. Yeah. The minus button. Yes, sir.
Good evening, and I'm extremely happy to be associated with Foxy. In fact, the way Dr. Neeraj works and fine. Dr. Apurba, Manish, they're quite a bit of inspiration for me to how to go about. We have already covered 3 topics as it was mentioned earlier. One is on communication. Second one on in fact, sensate focus exercises. The third one related to cognitive behavior therapy. In the same line, condensing majority of the aspects that were actually discussed time to time in this particular area and elsewhere would be actually the topic for today's discussion. What I can say is there may be an occasional repetition of a slide or some ideas, it only to bring to the focus one emphasis on certain aspects. The second one is related to the fact that there are certain things which need elaboration. The third one, when we are trying to talk about sex therapy, it is one of the very broad term. It is as good as somebody telling gynecology or obstetrics and all of that. That means there are multiple subheadings and topics likely to be operating in this whole section. So I'll be trying to look at all of these things in a way which I feel, even though you're all consultants and great teachers on your own right, this is one of the area which actually has been somehow left out or neglected in either in the educational aspect is concerned or practice aspect is concerned. Some of you are great sex therapists also. In fact, I can look at Dr. Manish Mahajan and others who are actually part of our fellowship program. They are doing an extremely great job. For some, it may look very simple, but I have to just make a balance between somebody who is a great expert to another person who is just entering this particular field. So there may be certain of these things may look a little repetition. Please excuse me for that particular aspect. I have my own way of presentation in the sense that occasionally I may be just focusing 1 or 2 videos. These are all actually aspects which have been done to break the monotony. That is one aspect of it. Second, rather 1,000 words, a small clipping of about maybe 30 seconds to 1 minute may convey a lot of meaning and actually to understand the concept. The third one, this presentation will have certain way to, one is actually will introduction. We take an approach what is called as multidisciplinary approach. One is you are there in the clinic and you are treating a case as a gynecologist too. In fact, there are occasions when a psychiatrist, a sexologist, andrologist, gynecologist, dermatologist, in each one of us, we have to actually contribute in some particular way. It all depends on the problem. Basically, no sexual problem would be one single point involved difficulty. It is not like, say, somebody is treating malaria and somebody is treating typhoid fever. It is a bio, psycho, socio, cultural problem. That means we have to bring in almost all these areas together. What it means is integrating physical, medical, psychological, social, and cultural influences. That way, the holistic management of an individual case can be carried out. Some problems are common problems and they have a simple solution. In fact, later I'm going to divide those problems which are individual based, and these are all extremely common. Why I speak about that, I'll come to that. And there are a lot of newer techniques are available which talk about, it may be look purely physical, say something like electrical stimulation. So here the technician involved can carry out the job without a sexologist being specifically there during the process. But all said and done, many of the what we call couple related problems, female related issues cannot be treated in that particular fashion at all is actually one of the experience what we have developed. Focus on management from sexual function to intimacy, sensuality, and relational satisfaction. This is what actually we are trying to emphasize all through. Say Sunset Focus was very specifically about this, and other related things what we were trying to talk about was actually one way or other was impinging up in this particular area. There are some special populations like very young to very old, a single person, and certain other complicated relational issues. Each one actually needs attention in a different fashion. So when we are trying to talk about the word sex therapy, there are a few important points in the beginning itself. We need to keep it in mind. One is, here many people believe that sex therapy means we are focusing on orgasm. Absolutely not. The sexual response, there is some difficulty, not feeling good about one's own or the partner's issues are concerned. This sex therapy intends to enhance lovemaking, intimacy, and this is not meant for guaranteed orgasms. It doesn't teach people to love one another, but teaches showing love by meaningful and pleasurable sexual expression. What it actually means, as I'll proceed, I'll try to elaborate on that particular aspect. And there are a few more other important aspects like success unlikely if relationship is in problem. I can tell you, in fact, recently, in fact, almost about 2 to 3 years, I have attended some of the urologists, andrologists, and some other specialist programs. Many of the time they look at if somebody is having erectile dysfunction, it is endothelial dysfunction, and you try to prove by various tests whether it is actually endothelial dysfunction. And if there is endothelial dysfunction, there are drugs available how actually to proceed. In fact, let me tell you, elaborate on this as I proceed. Giving medication not likely to, in fact, change much. Everybody believed that arrival of sildenafil citrate actually brought about wonderful changes in all married people's life. I can tell you, since the introduction of sildenafil 2 years later, on our 2,000 plus couples from China, what they actually found was that actually it has not changed anything at all. So bringing erection is going to be one wonderful situation. Yes, indeed it is, but it is not a sure cure for many of the sexual problems what we encounter in the clinical practice. When there is a individual is having some psychopathology, in fact, either it may be in the individual himself or in the partner, where one has to be first careful that we treat this particular issue. I'll try to elaborate, not psychopathology in the sense not only psychiatric problem, it could be even a medical or surgical or any other problem for that matter. That means it needs attention. Many of the people, in fact, we have come across people who the unconsummated marriages of 20 years. In fact, they are very happy. It looks like, at least on the surface. And those people are very particular. They want to continue in that particular thing. There is no reason in actually you will force these individuals to take treatment. So vested interest to remain dysfunctional, either by the patient or the partner, will not be actually able to do much actually in these cases, and we should not. Don't force anybody that therapist and you want to treat. So for those adjusted to dysfunction, don't impose sex therapy. This is one of the very important message in the beginning of 21 to convey. In fact, this is meant for those people who are motivated to change, motivated to modify their life. And this is one of the very, very important steps in the beginning. This is more than reassurances and prescribing some tranquilizers or tonics. In fact, nowhere these two things can be compared, but many people believe because they are writing sildenafil citrate or maybe some tonic or some special drug, that they are actually trying to carry out sex therapy. I still remember one of our postgraduate, we are seeing about a couple who are having difficulty. He went and another 5 minutes later, he came back and told, and he has done the sunset focus exercises for. This cannot be done that particular way. It is a process and it carries certain very specific guidelines. And it is a time minimum required is actually, it may take about 10 days, 15 days, 20 days, depending upon actually the situation, and one should be aware. You spoke and talked to them and you gave some psychoeducation. It doesn't necessarily mean actually it is sex therapy or sunset focus exercise. And the time will come, there is no choice for the doctors. And more particularly in the field like gynecology, in fact, I don't think there is any excuse not asking any question related to this. And we have already spoken in earlier presentation. One question we must positively ask is actually, do we have any sexual concerns to discuss? That one particular word, one particular sentence can open the floodgates, and many people actually come forward and try to talk about it. Many of the times, gynecologists, you receive the female patients. This is actually understandable. But all said and done, they are the most vocal, they are most reliable, they are the most motivated individuals for therapy. Unfortunately, when we see male or female, the males continue treatment and females discontinue treatment, not because of the fact that they are not interested, but the fact is that there are so many familial, social, and such other issues get into the picture. Husband has to bring her and she alone cannot come. And if she comes alone, there are a whole lot of issues and there are all social, cultural aspects are concerned. They are very sensitive. These are the type of things actually can vitiate the whole issue. Even when men come, many of the times it is actually the partner who has actually sent him for the treatment. Please remember, it is also possible that this particular individual who has come for treatment, he will believe sometimes that the wife doesn't know certain problems, what is actually he's going through. Absolutely, it is actually something what I can say cannot be true at all, for the simple reason that the first person who will come to know that this particular individual is having sexual problem is the partner. So there is nothing like hide and seek involved in this, and this particular treatment definitely need to be carried out in a particular way. If you don't take up this particular area seriously, a time will come where you will be labeled as you are negligent in the management of the case. So better be prepared for this whole aspect. And when in the introduction, the last point is contempt of sexuality is a crime against life. Everybody should take it up, and there is no choice other than this. Why it is important? This particular slide I have focused earlier also. We are all well aware now currently the sexual dysfunctions, they have been taken off from psychiatric section. A separate new category has been given in ICD classification. We are also aware sexual disorders are part and parcel of psychiatric disorders also. So also of, say, you talk about urology, medicine, or gynecology. In fact, each one area has its own special issues related to this. And in fact, they produce or effect of medical and mental illnesses. That means there is a strong cause and effect between these two. What it means is, see, leading to, for example, when we are trying to talk about sexual disorders, many of these individuals who have problems in performance or whatever it is, they carry this low self-esteem. Once you are carrying low self-esteem means automatically the whole range of interpersonal troubles you are inviting. You are dissatisfied with life, low quality of life. In fact, the recent classifications talk about this in a very big way. This may not, some of these type of things may not be too much important actually from your point of view, but the idea is the quality of life is equal and important from everybody, every therapist's point of view. The second point what we have to remember is this leads to depression, anxiety, and many people landing up with what you call substance abuse and things like that. In the movies and all, you might have noticed that if somebody love failure for various reasons, particularly men, starting drinking and a whole lot of things, actually they, in fact, this is actually one of the very common cultural phenomenon. When we are actually, the loss of love object means In fact, resorting to the substance use or abuse is one of the very, very common this thing. In our department, say for example, where master health checkup area is there is a diabetes clinic is also. What we found was that for a diabetic, you ask him to take medications, he doesn't take. You advise that of a diet, he doesn't follow the diet. You advise him exercise, he doesn't carry out whatever things have been advised. But when he realizes that sexual problem is directly related to this, and if you can highlight this particular point, automatically we have seen they become very adherent to the treatment, compliant to the treatment, relapse prevention can be brought about, and they're regular with whatever drug, including use of insulin. What I'm trying to tell you, how we integrate some of these type of sexual related issues and problems for the betterment of the individual is one of the very, very important area we should keep always in our mind. This slide I have projected earlier, what it means is sex is one of the very important aspect in individual's relationship, and there is no shortcut for this idea. Opportunity for expression of passion, affirmation of one's body and functions, maintaining strong sense of identity, assertion, and removing anxiety, bringing about intimacy, feeling of security. It defies the stereotype of aging. Pleasure is one of the things actually every human being is actually seeking. Being touched, caressed, and romance, they are extremely important steps. And this is one of the important avenue for relationship growth and experience. So when we are trying to talk about sex therapy, let me tell in the beginning itself what we actually mean by that. Sex therapy carries very constrained meaning to very elaborate, extensive meaning actually. It is very strictly used to, in fact, very loosely used. Sex therapy is the treatment of sexual issues through empirically proven therapeutic techniques. Sex therapy is a specialty of traditional therapy and works directly with sex and intimacy issues within a relationship or with an individual. See, look at this particular whole issue. The second point, this is having a basis of what we understand the whole principles and concepts related to the sex and issues related. Directly, it involves relationship issues. Intimacy, sensuality are extremely important component, and without this, it is almost impossible to get what actually the desired effect. And who can do this? A qualified sex therapist. In India, there is nothing like a particular qualification for sex therapy. Anybody with MBBS degree is actually can be a sex therapist also. What it means is he should have some idea how to go about. We all started our sex therapy practice long ago. As a postgraduate student, I still remember once I presented one case with so much of issues related to the affairs and so many other such things. My professor told me, you make a diagnosis of schizophrenia, you start him on antipsychotics. What I'm trying to tell you, we have done quite a bit of mistakes in our learning. Experience is the name everybody gives to their mistakes. But without doing mistake, you cannot be a specialist too. These mistakes could be small. These mistakes could be easily overcome. If actually you show interest and how to go about, in fact, that can bring about a whole lot of changes. And you want to become a sex therapist means you are having a very busy practice and one patient on the couch for vaginal examination and two other patients are sitting there and 3-4 relatives are there inside the room. That is not the way actually you will be able to get the patients. A sex clinic means you should be able to provide confidentiality, privacy, being non-judgmental. Few of these type of things are extremely important. Without this, that means a little bit of background psychological concepts makes wonderful changes, and a well-defined ego and no over-involvement are extremely important components which are necessary. Own sexuality, the individual is having healthy attitude. I was giving an example. Say, for example, when I was doing PG studies, this example I have given, but there are quite a few newer people are there involved in this session. That's why I'm repeating it again. One of the senior PG coming and telling her that your husband was watching so many women on the way. Her comment was very simple. More hungry, that much better. See, a little bit of attitude change can bring about remarkable issues. Quality of empathy, your capacity to understand objectively the others' sufferings. He understands the personality and counseling issues. His communication is warm and effective. both verbally and non-verbally, people get confidence in him. He has the inherent respect for others' problems, regardless of age, sex, socioeconomic status, race, and religion. So also, in fact, his life satisfying and rewarding, safeguards confidential information, relates to client in an open and trusting manner, creates supportive climate in the interview, honest feelings and opinions he gives, knowledge for treatment and referral he is having adequately. If somebody is having psychiatric problem has to be treated. If somebody is having medical problem, you cannot actually proceed with the treatment without correcting the medical problem. Cooperation with professional colleagues is one of the other important aspects which is necessary. So coming to what sex therapy is not. This I have copied it from the Google, and people believe that sex therapy is not phone sex, conversation related to eroticism. Sex therapy is not surrogate partner therapy. Sex therapy is not eroticide or sexual in nature. Sex therapy is not done by a counselor with little sex therapy experience. Sex therapy is not hands-on or active coaching during actual sexual experiences. People actually made to have sex, and you want to detect what is the mistake that they are actually trying to do. That is not sex therapy. Sex therapy is not usually just isolated to sex. It usually is a life therapy in a sexual context. So these are important points one should remember. And what we are talking about, this is again from the Google. And I'm saying that I'm sex therapist, what my friends think that, in fact, I do oral sex. I actually see clients. I am having sex with the client, what my boss thinks, what I think I do. And in fact, ultimately, with a whole lot of confusion. So what I'm trying to tell you, these are not sex therapies. Be very clear. And the least, at least one should be well aware, there are significant social, cultural, legal related aspects which are there. One has to take care of all those things in the practice. Extremely important. Without this, one can land up with problem. Indian Psychiatric Society came out with sexual dysfunctions, what we basically call clinical practice guidelines. I am one of the authors related to the sexual dysfunction area, and we have covered in great detail how a person, a therapist should proceed, starting from the simple to the complicated way. How common each of these type of problems. How actually one should proceed in different contexts and situations actually. All of these things have been described in great detail, I think more than about 28 pages. It covers all the related aspects, how clinical practice guidelines means for a therapist, which is actually helpful for managing the cases. Areas of sex counseling are many where sex therapy comes into the picture. Children and youth on sexual developments, parents' concerns, adolescent young adults have a lot of relationship-related issues and questions. Premarital counseling, married people have relationship issues, pregnancy and whether sex is permitted or not, varieties in sexual expression need, older people, how one should proceed. If somebody is having an illness and sexual issues, they are extremely important. Many of the times, in fact, what is being said is that somebody is having coronary artery disease. He is willing to die not because of anything, but because the therapist has told him that he cannot have sex. These are all wrong advices which are given. Be very clear about it. Gender identity and such other related issues. So the field is extremely vast and one should be well aware of what actually he is trying to do. Let me look into sex therapy means how actually I understand it and what I can suggest to you people to go about. Sex therapy principles and practice. One is you have to be flexible and tailor-made because each individual is significantly different. Each couple is actually something totally different. They are all products of family, culture, and society. So what is actually being said is that eclectic approach. Your capacity to tailor-made to this particular individual or couple is extremely important. We have one of the best known method actually how to proceed. May not be possible. You are a sex therapist sitting in some place and they are in Lucknow, how one can proceed. We are now online to lot many other such things have come up actually. I may not be too comfortable with many of these aspects, but people have actually understood that something can be done.
Hello.
Who is having the problem, actually that need to be attended in some particular fashion. When couple have come, we have to follow some particular way. Marriage and other related issues are there, how it can be combined. Group therapy, possible or not. And nowadays, what we are actually coming across, same-sex individuals and in fact, whether some specific issues are there. I will not elaborate on group therapy and same-sex for the simple reason that, in fact, the issues involved are a little different. And if questions arise, I will be positively looking into that particular area to elaborate on. Coming to history of sex therapy. See, when we are trying to talk about sex therapy, the word, the one which actually comes to my mind is straight away the Marston Johnsons who developed this particular concept and the people around that. And I request the admin to mute all the people who are not there. Okay, request. So, the point here is actually that Marston Johnson's, if you can take that as the pivotal situation before and after. Before Marston Johnson's came, I just want to emphasize one or two small points, and this is not elaboration of any of these things. And when you, if you want to understand what actually Freud and other people around that particular time, the psychoanalytical school, psychodynamic school spoke about, we definitely need another maybe 1 to 2 sessions for that understanding this. Addressing deep-seated anxiety, people have conflicts and that need to be sorted out. There are mechanisms which are actually called consciously what we see, but they are all determined by unconscious mechanisms. There are different defense mechanisms are involved. Instincts, in fact, there are life-sustaining instincts and there are actually what we call ending, in fact, life-ending instincts and psychosexual development issues related to. I'll not go into the elaboration of this, except that to emphasize the point that, in fact, I was very fortunate to visit Vienna and of course, Vienna I have gone at least about 7 times. And one of the visits actually made is to the Freud's clinic and the Sigmund Freud University, which is there. And we could participate in some of the seminars and symposiums there. In fact, what is Freud who mentioned about subject of choice and sex, and what he mentioned is a window to understanding the mind. And he is the one. In fact, the very fact, the libido terminology, what he used, indicates sex and beyond, all that energy. If somebody feels like talking, in fact, this may have some implications related to the sex. Somebody is silent, it may have implications related to the sex. And everything and anything may be related to this whole idea. This is what actually he spoke about. He spoke about many theories. In fact, at least about 10 one can actually talk about. I'll not go into the elaboration of any one of them in great detail. One of the structural theories spoke about is actually id, ego, and superego, wherein id is actually a basic instinct. Ego is actually the reality principle. Id is actually what we call pleasure principle. And there is actually something that Yabo had sitting actually and controlling the moral and lot many things, what we talk about superego. Each of these things are extremely important components, and many of the behaviors, individuals, what they present, in fact, may be related to. In fact, I have seen a doctor couple. One was a dentist and another one was a medicine individual. In fact, they started courtship when they were doing MBBS. The only sex what they could do was actually the oral sex. And when it actually came to the physical sex, they were actually unable to do it, and a whole lot of issues that came up actually. It talks to about an idea where, in fact, each one of these areas can develop and stay at that particular level, and seeking pleasure without reality principle being there. And when somebody is having the reality principle as something extremely important, this moralistic and orderliness and lot many other these things, actually how it can interfere, this is one of the very important component one should remember. Later, if you ask questions again, I'll try to go on to that. There is another theory called as topographical theory. What we are seeing is only 10% of what the whole mind's work is. There is something at the surface, pre-conscious level too. In fact, much of it is unconscious. And here, in fact, whatever is uncomfortable for me, the defense mechanism, the repression means actually pushed. And if the repression is complete, things are fine. But unfortunately, it is not so. It is having a lot of energy of its own, which tries to come to the surface again and again. That's where again you have to operate what we basically call different defense mechanisms, and actually it works. He speaks about psychosexual development, oral stage, anal stage, what we basically call phallic. Then in between there is something called as latent phase, and then the genital stage. Pictorially, in fact, this is very clear cut, but let me just tell you one or two small points. Currently, I'm trying to treat a patient in a different country, wherein this particular husband is very particular to a lot of rules, regulations. Neatness, cleanliness, and all of that. And the last session about 2 days ago, when I was talking to, what I could find out was, in fact, on the bed, there is a pillow which has not been put cover. Last 3 days, he is watching and she has not done it. And because of which he could order something and she got upset, and the quarrel went to the extent of why I should live with you and divorce and such other related aspects. Now, can you imagine what I am trying to tell you? If our psychosexual development goes smoothly, things would be fine. And many of the problems related to, in fact, what we basically call anoncastic personality or type A personalities, are those who are having a lot of drive, energy, what we basically call discipline. These are the people who land up with a whole range of sexual problems. And you take an example, they're also called as coronary artery disease-prone personalities. They're also likely to suffer from a whole range of gastrointestinal disorders, including gastritis to IB, irritable bowel syndrome and things like that. Likely to present with a whole lot of what we call starting from menstrual, sexual, and such other those things. So what I'm trying to convey, the personality may be one of the major determinant which actually looks into the whole lot of things. Many people actually, they find it very difficult to growing up. They go back to the earlier phase, which they were actually very comfortable. So one of the oral fixations is actually smoking, nail biting, taking alcohol. No, you got the point. If some of these type of things actually, of course, biologically speaking, we are all now talking in a different fashion altogether, but all said and done, they have a very significant role to play. Anal fixations, orderliness, obsessiveness, and rigidity, which actually puts off the partner to a great extent. Vanity, exhibitionism, pride, and lot many other such related things which have been attributed to the phallic fixation. What I am trying to convey the message here is, those psychodynamic theories are now not in that vogue, but all said and done, they may have a very significant role to play in our understanding. And we use different mechanisms. There are some mature mechanisms are there, some are neurotic, some are immature, and some are significantly greatly pathological. So when you are trying to talk about pathological, the denial, distortion, magical thinking, some of these type of things could be actually real problematic. This range of what we call narcissistic, immature, anxiety generating, mature, these are all specialist areas. Let us not go into too many details. The message conveyed here is actually that defense mechanisms matter. In one of the earlier sessions, I have spoken about CBT. People carry a cognitive distortion that they assume that some people should actually, in fact, go about in a particular way. In fact, minimizing, maximizing, distorting, all of these type of things happen because this is what we actually have learned. This is what actually the people told us, and are actually, in fact, the experiences in some way actually related to this. This can lead to quite a bit of difficulty and problem. So to deal with sexual anxieties, addressing behavioral repertoire, challenging individual irrational beliefs, they form sex therapy component only. In fact, without correcting some of these type of things, you cannot think straight away moving to what we basically call, I want to do an intensive sex therapy. So next about 5 or 6 slides, I am just putting it up for the reason that those who are actually young and who want to academically pursue this particular idea, this will be quite useful. You just have a look at it. Then I'll try to tell you in simple terms what we are doing, or what I am specifically doing in what we call when sexual concerns are brought into the focus. Physiological, psychourological, medical makeup, majority of these type of things are there. And we are aware of the linear mechanisms. That means when you are talking about sexual response cycle, there is a desire component, there is arousal component, there is orgasm, and there is resolution. If there is a problem in desire, it has to be treated first for arousal to happen. If there is arousal problem is there, you just cannot expect orgasm will happen. So you have to correct this. So linear model talks about this. In fact, I have spoken earlier, when you are trying to talk about female sexuality, the relationship, physical, psychological subsystems, they form actually extremely important components. And one of the things, in fact, I'll come to that particular diagram 1 or 2 minutes later. So one should keep it in mind, all of these type of things has important components. When I was talking about psychoanalytical related concepts to psychodynamic, now the certain aspects it has been modified to. In fact, it is a totally evolving process, and a lot of theories have been brought into this particular area. Systematic therapy is what Crow and Ridley mentioned about. Bringing about humanistic ideas. What it means is, see, one of the classical example is actually Maslow's, where the minimum physiological needs are not met. The esteem and to the ultimate what we call self-actualization, that particular level individual will not be able to reach. That very mundane things, they are extremely important to be attended. To the feminist, why actually men are necessary. In fact, I can manage my life in particular way. There are a whole range of, in fact, different groups are there and different therapies for different people. Informal, unstructured therapies are available, but again, it is actually something one has to learn in a particular fashion. Marston Johnson is one of the very important names in this particular area. Human sexual response, what he propounded in 1966, human sexual inadequacy. That means there's a problem in sexual response cycle. In 1970s, homosexuality in perspective, starting from, there is nothing like somebody totally homosexual or somebody totally heterosexual. In between, there are about, not in between, there are actually 7 steps. Significantly homosexual to significantly heterosexual. So all of these type of things have been covered in great detail. Just to bring to the focus for keeping my understanding of how actually one will proceed, men and women actually marry means there are 2 people who are marrying, who are having totally different background, and biology is one of the very important area where a lot of differences can happen. Men are very fast on the gun. They can get aroused very fast. They ejaculate. And there is actually a refractory period at that particular time. It is not possible. Women, they take their own time to actually get aroused. But once aroused, they can be multi-orgasmic. In fact, the resolution may happen, but she can reach orgasm again if actually properly taken care of. Some people can be multi-orgasmic in laboratory situations, what has been documented too. Many of them may not reach orgasm at all like that, but they are happy with life. All of these type of things are actually have been documented in what we basically call the Marston-Johnson theory. The linear model talks about this is what the desire, arousal, and plateau. What Marston-Johnson mentioned, which actually has been taken off, arousal and orgasm. So these are the few steps linear model what talks about. But when we are trying to look at Marston-Johnson's model, this was primarily talking about physiological functionings. But the life is actually something totally different. It is colorful, and people are very much concerned about romance, relationship, and such other issues. And when you are trying to talk about couple therapy or the female sexuality, in fact, these terms carry extraordinary meaning. Seduction, sensation, surrender, reflection. These are the terms which actually people have used. And this is the concept of David Reed's erotic stimulus pathway. Extremely important for sex therapy point of view, you should remember. And I mentioned earlier the circular model, what Basson mentioned. This is extremely important from female sexuality point of view, because see, you look at, she can have multiple blocks at multiple level. When we are trying to talk about, see, I can tell you, in fact, one of the step is actually bibliography or video modeling or a whole lot of things. When sex therapy was initial, in fact, what I'm talking about a case about more than 2 decades ago, there is a video which actually she has to see to make understand. In fact, there are educational videos which are available. At the end of the session, when we asked her, all through the session, she has closed the eyes. What it means is they carry so much of negativity related to anything related to the sexual too. In fact, somebody is responsive, but all said and done, She can get distracted by whether the curd what she has is milk, whether it is set for the curd or the boy's bag is ready for tomorrow's class. Breakfast, how to prepare, what to prepare for the husband to take home, take out to the office. So large number of things can actually interfere with female sexual functioning. This is what actually Basson mentioned. And one of the terminology used actually here is actually the circular model. Let us look into, there are a lot of other schools are there. You just look at the names and you forget about this. You don't have to spend too much of time. But I cannot complete this thing without bringing this idea. What I am trying to do is, this is the sacrosanct and that is not, I cannot say. People have done a whole lot of things, and depending upon our expertise, the context, the available facilities, one can actually work on how to go about in this particular area. Integrated sex therapy is actually which came up on the DSM classification that Marston Johnson's, which was actually incorporated. What Marston Johnson mentioned, plateau, that particular word has been knocked off. Now we talk about only desire, arousal, orgasm, and relaxation. Essentially biological and medical viewpoint it carries. Relationship and psychological factors get neglected to a great extent. This is what actually one can say. Comprehensive sex therapy combines Marston Johnson, what they propounded, with other psychotherapeutic techniques. So that means you are trying to look at the problem in a little broader perspective. In fact, there are sequential linear model, what I a few minutes back mentioned too. In fact, the Basson's circular model too, a lot many other such terminologies are there. The point is simple. You look at ICD classification. In fact, a whole lot of categories are there. Lack of or loss of sexual desire. There is no mention of anything related to the relationship at all. Vaginismus, what we basically call dyspareunia, non-organic. In fact, there are actually studies available which were actually considered as a functional vaginismus, dyspareunia, non-organic vaginismus and dyspareunia. People found, in fact, Anna Maria Geraldi's work in this particular area is actually very renowned, and they could find a lot of causes. But unfortunately, the classification doesn't make any provision at all for that. Some extent better, DSM classification. They have tried actually to make division into psychogenic and organic. Emotional satisfaction as one of the other category, but all said and done, this was also falling short in a very significant way. Before we start about sex therapy, what is the diagnosis we have made? It is also possible that the symptom and sign clusters can be taken and one can manage, but we have to have a diagnosis or differential diagnosis, and it's extremely important that when you are trying to talk about male, hypoactive sexual desire disorder, that means the desire is the problem and that need to be treated. Delayed ejaculation, primarily organic. In fact, what we are trying to talk about premature ejaculation, primarily psychogenic. There is no definitive organic factor documented for premature ejaculation at all. You look at female. It is very difficult to differentiate what is desire and what is arousal in this particular gender. So sexual interest and arousal disorder have been combined together. And in fact, earlier seminars Foxy conducted, we have already spoken about sexual interest and arousal disorder in once at a time. I think they're all available either in the YouTube or the link may be available for this. Genitopelvic pain and penetration disorders. This is another category. The earlier sexual aversion disorder, which used to be there, I have treated one of the cases. In fact, sexual aversion disorder, rare but extremely commonly encountered in sexual medicine practice in a very simple fashion, to a very significant case also. I remember one of the case where we treated some of these individuals for almost about 3.5 to 4 months. Luckily, only in case of female it is seen. In limited number of patients, this has been documented. And apart from drugs, the range of psychotherapeutic and behavioral techniques are necessary for management of this. Hypersexual desire has been now knocked off. When you are trying to talk about sex therapy, hypersexual disorder, we don't talk nowadays because this particular whole category has been knocked off. The sexual addiction disorder and such other things are there. The issues are something totally different. We'll talk some other time if necessary arises. But the important point is, primarily this is seen in the movies and novels. In fact, woman can be sexual, she can show interest, she can get aroused very fast, and some of these terms are the positive attributes rather than actually a pathological state. This is actually the current understanding. So these are the two important things what we should remember. Gender dysphoria is actually the current terminology where gender identity disorder we used to treat by sex therapy techniques, but now it has been totally knocked off. That is one of the other special area. I'll not elaborate on that particular thing to a great extent here now. Paraphilias and paraphilic disorders, paraphilic behaviors and paraphilic disorders, where something unusual, inanimate object, animals, something against law, receiving pain, giving pain. And these are the things which occupy the whole aspect of the individual, and it needs a totally different level of treatment. I'll not elaborate on. So my emphasis would be on actually the sexual response cycle and problems related to that, how actually one can go about. I spoke about ICD system and DSM-4. For the treatment of sex therapy, you should remember this WPS system, which actually has come into being, which is extremely clear about what actually we're supposed to do. See, for example, Axis 1, it talks about sexual disorders, and second be other mental and general medical disorder. Now it is believed that if there is a particular comorbidity is present, that particular comorbidity has to be treated first. What extent this has produced disabilities? What are the contextual factors? What are the quality of life issues? So what we just generally mentioned earlier, now this has become one of the very important area. So just to give you a little bit of idea, and then I will move, the clinical disorders. Axis 1 contains A and B, the comorbidities. Disabilities, when we are trying to talk about personal care, occupational, with spouse or partner, with other relatives, social in general, how actually a partner is having problem, but the person gets labeled as actually problem. We have elaborately described some of these type of things. It actually classifies minimal to massive. And one of the things which actually in sex therapy people forget about is actually the family house, education work, economic, legal, cultural, environmental, and personal issues. Let me tell you why this I'm emphasizing at this particular level. When we have done actually those cases which had a significant problem, unconsummated marriages and things like that, what I try to do is actually admit them for at least about 15 to 20 days, or sometimes it may be even 30 days, for two reasons. One is, see, we talk about going for honeymoon. Why? Because we want to be totally free from all our day-to-day related problems. A man has to get ready for tomorrow's morning presentation in the office. She has to actually manage extra cooking because few relatives have come. These are not the candidates for actually thinking about sex. They'll end up in difficulty. There is actually one single tenement, one single room with about 10 people there inside. In fact, one of the very common problem in Mumbai and certain major metropolitan, cosmopolitan cities, absolutely, in fact, you cannot actually carry out sex therapy where privacy is not there. In fact, somehow they are adjusting and trying to do. In fact, these are not the places actually going to work. You cannot do intensive therapy with somebody who is not educated. In fact, this needs a particular level of intelligence on the part of the patient, spouse, and actually the therapist to deal with. Culture and environmental, there are few people who actually refuse in some particular way to proceed forward. You cannot do anything at all at that particular level. And personal, that means what I am trying to talk to you is when you are trying to talk about sex therapy, all these dimensions you have to keep it in mind. Quality of life, there is a visual analog scale in case of what call a WPS system, starting from poor 1 to 10 excellent, how actually, in fact, before and after treatment. I have brought in few slides here just to bring you to your focus. If somebody is a smoker and he is likely to develop sexual problems, and more particularly the erection problem and things like that. It is almost like, in fact, it is one of the major stigmata related to coronary artery disease. And this is also true as far as the sexual problems is concerned. In fact, this produces problems. How actually you can help him overcome this, actually the smoking and such related habit. In fact, you have heard, in fact, it's so easy to leave. I have left it 1,000 times. It only indicates that repeatedly again and again, people get into that particular habit. Unfortunately, stopping is not possible. There are a range of treatments available, how actually one can overcome that. Somebody is having alcohol dependence syndrome. You cannot treat his sexual problems unless you treat his alcohol problem also. Alcoholism can affect in so many ways. It can affect fertility. It can affect sexual functioning, both. And relationship goes to the toss. I still remember one of the programs when we were conducting, the husband and wife are supposed to come and they talk about his alcoholic habit. In fact, one fellow came and told, sir, I am not like other alcoholics. I am actually well under control. I drink true, but I come back and sleep without giving any trouble to anybody. When wife's turn came, her response was very simple. Sir, what to do with a man who too much sleeps? No, you got the point? And many people are put off with an idea that, in fact, alcohol, which actually like acts like an aversive stimulus for many women. I have come across cases where, in fact, a husband chews pan. He is willing to leave the wife, but he cannot stop chewing pan. In fact, wife is not willing to stay with him or participate in his sexual activity because he chews pan, which she feels very uncomfortable. This was one of the Jain couple, what I was trying to treat. What I am trying to tell you, extremely important. Depression is extremely common. Many people, what we see in the drawing room is something totally different from the bedroom related to this thing. In fact, losing libido is one of the most common indicator is the depression. Sometimes it will be so subtle also, unless when go into the details, one may actually get into the difficulty. Whole range of antidepressants, what we use. Now there are better antidepressants are there, one has to choose that. Hypertension, antihypertensives, coronary artery disease, very strong implications related to, in fact, they are using so many drugs, and that many of the coronary cardiac specialists actually discouraging people in a very significant way is very, very not well known. And before we start off sex therapy, no man can be made into a Superman. We can take them into the pre-morbid level of sexual functioning. Keep it in mind, primary psychiatric disorder and treatment what he is taking, physical disorders and actually the treatment what he is taking. So all of these things have to be combined. I just focused one of this prescription. See, this particular individual is taking about maybe 10, 20 medications. Which drug is producing what problem? He comes to a psychiatrist and we actually give another 1 or 2 drugs. You imagine it's a cocktail of so many drugs and it almost becomes impossible actually to understand and deal with. Not eating, losing weight is one of the very important of those things. And many people overcome anxiety by eating excessively also. When they quarrel with the husband, in fact, they may not eat at that particular time. Once he's out, they may empty the whole fridge, and putting on weight is one of the very common things. Obesity, in fact, lot many other things, anorexia, lot many other things that can be one of the major common problems for problem. Because you are gynecologist, I thought there is one small video which can actually bring to the focus, which you often may miss it out.
Sona 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 जाने तेरा मोल ना come तेरी लोहा तू हो जाए अनमोल तेरी लोहा तेरी लोहा लोहा ओ हे लोहा चले लोहा ओ हे
What I was trying to convey, anemia is one of the extremely common problem actually in women. One should almost always keep it in mind. A proper examination and reaching a particular level is extremely important. So in conclusion, what I can say at this particular level, before I tell you what actually I'm going to do, clinical problems and their contextualization is extremely important. Look at what are the positive factors of the patient. That means whether he's motivated, his capacity to participate, the expectations on restoration, promotion of health. If somebody is asking you, he wants only some injections and tablets and all for the treatment, he is not for the intensive therapy at all. So these are a few important steps I just wanted to tell you. And nowadays we're talking about sexual wellness clinic. It is not actually purely the sexual problem what we are trying to talk about. We are talking about intimacy and relationship issues. They are extremely important. Some of these things we might have already mentioned earlier in our presentation. I have now coined the term what we call as TSS method based on my this thing: total intimacy, sensuality, sexuality and sex therapy. In fact, these are the three important components in the whole this thing. Sex therapy rarely a simple performance problem with a simple cure. Sexual issue is profound human relationship problem. It affects quality of life of individuals and couple. And when we are trying to talk about management of sexual problems, the marital and sexual issues are supposed to be combined together. In fact, one of the area which gets likely to affect it is actually the marriage. Marital discord and sexual difficulties are intricately interconnected. 50 to 80% of the couples seeking therapies, in fact, this is one of the very important area where difficulties are documented in one area or other. Reciprocal pattern leading to escalation of sexual dysfunctions is very well documented. Addressing relationship problems and therapy increases treatment adherence and better outcome. Combining marital therapy means how one can go about. Anxiety in general and in the relationship is very well known. Performance anxiety, spectating, whether I'm doing, in fact, this is what we spoke about in cognitive behavior therapy. Negative valuation of the self, in fact, because of which it feels shameful and a whole lot of issues get into. Perfectionism. In fact, this is actually one of the area where one has to be flexible and look forward to the pleasure component rather than whether bed is actually arranged properly or a whole lot of such these things. A little plus minus here and there. In fact, people get so much upset and a whole lot of things actually. Before sex, in fact, I want to take bath. In fact, fine enough if both are willing. But by the time she takes bath properly and comes back to the bed, in fact, the man may lose all the interest that is actually there. Negative relationship dynamics, unrealistic expectations, these are all important factors. In fact, one has to. The expectations are something extraordinarily great. In fact, people believe that, in fact, I was so well and then I married and a whole lot of problems have come up. And the expectation is one of the area.
Hi, कैसी हो?
What is this यार नवेद? मैंने तुम्हें क्या टाइम दिया था आने को? 10:30
हाँ।
और अभी क्या हो रहा है?
10:35.
So तुम पूरे 5 मिनट लेट हो। तुम्हें पता है मेरी ना तुमसे कुछ एक्सपेक्टेशंस है लाइफ में।
मैं बताता हूँ
मुझे
एक्चुअली
नहीं जानना, मुझे बिल्कुल नहीं जानना। तुम्हें पता है मेरी फ्रेंड है ना, उसका बॉयफ्रेंड हमेशा टाइम पर आता है। इनफैक्ट वो उसको पिक करने जाता है।
नहीं,
मैं तुम्हारे लिए वेट कर रही हूँ।
मैं एक्चुअली हुआ क्या मैंने
एक्चुअली कुछ नहीं सुनना नवेद। तुमने पता है मुझे लास्ट गिफ्ट कब दिया था? 2 दिन पहले। यू नो व्हाट? मेरी लाइफ में तुमसे कुछ एक्सपेक्टेशंस है यार। और तुमने क्या किया मेरे लिए आज तक लाइफ में?
मैं वही बता रहा हूँ।
नहीं, तो कुछ नहीं लाइफ में। तो बस ये कर सकते हो कि तुम मेरी एक्सपेक्टेशंस पर पानी फेर सकते हो। तो बस ये बताओ कि लास्ट टाइम तुम मेरे लिए एक बड़ा सा टेडी बियर कब लाए थे?
मेरी बात
1 मिनट, मुझे तुम्हारी कोई बात नहीं सुननी। तुम्हें पता है पिछले 5 घंटे से हमने इंस्टाग्राम पे कोई फोटो अपलोड नहीं करी है। अभी तुम्हारे फ्रेंड का फोन आ जाएगा, तुम्हारे पास घंटों होंगे फोन पे बात करने के लिए, लेकिन मेरे साथ क्या? कुछ नहीं। यार मेरी ना लाइफ में तुमसे कुछ
एक्सपेक्टेशंस मेरी भी हैं। बताओ, सुनो, तुम्हें पिंक कलर पसंद है, इसका मतलब ये नहीं कि दुनिया की सारी चीजें तुम्हें पिंक लाके दे दूं। मैंने अपनी ब्लैक मनी पिंक कलर करके तुम्हें दी है, उसका खर्चा किया मैंने। और मेरी बात सुनोगी, मैंने एक्सपेक्ट किया था कि मैं मोहब्बत में तुम्हारा दिल ले लूं। दिल से बड़ा तुम्हारा बिल आता है। तुम्हें मालूम मुझे कौन सा कलर पसंद है? मुझे ब्लू पसंद है। क्या दिलाया तुमने ब्लू कलर का आज तक? ब्लू कलर के नाम पे मेरे पास सिर्फ 2 मूवीज पड़ी हैं। एक्सपेक्टेशंस, मैंने एक्सपेक्ट किया था कि हम दोनों हमसफर बने। एक कैब वाले और मुझ में ज्यादा फर्क नहीं है। फर्क सिर्फ ये है कि बिना ओटीपी के तुम्हें हर जगह छोड़ देता हूं, और ये भी इधर लाओ, इसका बिल मैं देता हूं। और ये क्या बकवास कर रही हो तुम? प्यार नहीं करता। जितनी बात मैं अपनी डैडी की नहीं मानता, तुम्हारी डैडी की मानता हूं, जिससे मोहब्बत करती हो तुम। 15 ड्रेसेस, 4 फिल्में, 9 डिनर और 7 लंच के बाद तुमने मुझे की चेन गिफ्ट किया था, और वो भी खुद रख लिया था कि ये मेरे नाम से शुरू हो रहा है। तुम पूछ रहे हो मैंने किया क्या है? अब तुम कैलकुलेट करो। 5 साल से हमारा अफेयर चल रहा है। हर महीने 500 रुपए का रिचार्ज कराता हूं। 1 साल में कितना हुआ? 6000। 5 साल में हमारा हो गया 30,000 रुपए। हमारा 5 साल से अफेयर चल रहा है। रोज तुम्हें ऑफिस से लेने जाता हूँ, फिर घर छोड़ने जाता हूँ। एक दिन में पेट्रोल लगता है मेरा 500 रुपए का। पिछले 5 साल में कितना पेट्रोल लग गया? 7,20,000। इधर सुनो एक्सपेक्टेशंस। हर बर्थडे पे तुम्हें 50,000 रुपए का गिफ्ट चाहिए। पिछले 5 साल से बर्थडे मना रहा हूँ। 1 साल का 50,000 रुपए का गिफ्ट, 5 साल का कितना हुआ? 2,50,000 रुपए। हर साल आउटिंग के लिए बाहर जाते हैं हम। 1.5 लाख रुपए खर्च होता है मेरा। पिछले 5 साल से जा रहे हैं। 1.5 लाख इंटू 5 कितना हुआ? 7,50,000 रुपए। हर वैलेंटाइंस पे तुम्हें 25,000 रुपए का गिफ्ट चाहिए। 5 साल से अफेयर चल रहा है। पिछले 5 साल से 25,000 रुपए का गिफ्ट दे रहा हूं। कितना हो गया टोटल? 1,25,000 रुपए। ये वैलेंटाइंस हम दोनों के लिए होता है, सिर्फ तुम्हारे लिए नहीं। अगर तुम्हारी एक्सपेक्टेशंस होती है तो हमारी भी एक्सपेक्टेशंस होती हैं। ये देखो, इसे भी मुझसे ही एक्सपेक्टेशंस है। तू वहां पे बिल देगा तो ईएमआई में पेमेंट करेंगे क्या? बिल वहां पे दो।
I was just trying to bring to the idea in many of the families, they want everything in some particular fashion. But how actually you spend some time with the couple to make them understand each other is one of the very important. This is what actually we spoke in communication and the related area in great detail. There are a whole range of other therapies are there. I will not go into the elaboration of this. This Maudsley's psychosexual and couple therapy clinic has followed a particular order. Behavioral systems model actually has some emphasis on certain aspects. Psychobiosocial model of Austin and Heman. In fact, he emphasizes on certain aspects. Multifaceted intervention, sex therapy, in fact, what actually they call MIST. This is one of the things. Sexual crucible model. What it actually means is every case has to, in fact, there are so many things. A crucible means we are all well aware. In fact, that BeetleNet and other, we press it and all make it actually our Goldsmith. He puts a lot of different things and ultimately brings about a whole lot of design by actually what we call liquefying certain metals and all, maybe the gold or a whole lot of things. So the idea here is actually integrating medical, couple, behavioral, cognitive, and psychodynamic therapies together. This is actually the MIST talks about, and more particularly, in fact, John McCarthy talks about good enough sex model, adaptation and modification of psychosocial model, taking away emphasis on performance and focusing on pleasure. Failures and disappointments are normalized, in fact, rather than emphasizing too much on that particular area. Sexual dysfunction regarded as opportunity for increased cooperation and intimacy. Ultimately, the point here is actually sexual or the couple satisfaction. We are looking at pleasure, relationship intimacy, and satisfaction as important steps. And this is what actually the Levine has mentioned. There are 3 components for identity and 3 components for sexual function. The 7th one, emotional satisfaction. Those who are actually happy with their life, satisfied, in fact, they are likely to seek positively the relationship, sexual activity. Those who actually, anything can be there actually, starting from depression to 100 other things, which can interfere and create problems. You are talking about alcoholism, smoking, 100 other such as things. Intersystems model talks about couple, family, and even the cultural system. Ultimately, the range of things, and it all depends on level of analysis. If we are trying to look at bringing about erection in an individual because penis is there and erectile tissue is there and we are giving an injection to bring about erection, or what we call a PDE5 inhibitor to talk, it is a little picture. 2, in fact, many of the problems are social problems. There are a lot of other surrounding things are there which that need to be attended to. So from that particular angle, marital intimacy, sexual communication, sexual interaction, they are all extremely important components. Men actually almost always worried about their anatomy, physiology, and all. In fact, this is one of the very, very commonly reported those things. And when we did a study on almost about 600 letters, what we had received, what you have to do is actually correct their myths and misconceptions in the beginning itself. Size of the penis, masturbation, ejaculatory difficulty, premature ejaculation, these are all extremely common problem in the general population. People carry a lot of this thing. When we did this was actually the study based on 200 plus clinic population and hospital population. And these were all very commonly reported these things. Among the female, lot of myths and misconceptions people have documented. In fact, starting from orgasm problem to, in fact, the size of the breast, anatomy, various other such things are extremely common. They are worried about age. They are worried about features. And many of these type of things actually lead to quite a bit of this thing. So when we are trying to talk about sex therapy at a very minor level, say, for example, if an individual has come, a couple have come, there are few things which actually they need to be given permission. Whether I can have sex at the time of menses. Okay, that's fine. I remember one of the couple referred from my native place, Shimoga, wherein actually this fellow is not able to perform. When he went into the details, wife told that, in fact, this fellow refuses to close the door. What is the problem? My parents have brought me so much of love and affection. If I close the door, what they will think. So here the only issue is permission giving. Some people may need to be given little extra information, limited information. Some people may have to be given specific suggestions. Many of the problems can be solved at that particular level. And only a small number of individuals where the intensive therapy is called for. So how actually the precedent model has worked and how many people have improved and all, there are few things. And this is one of the model what we have developed. People have ignorance, you try to correct it by educating them. Cultural taboos and myths are there by permission giving. Poor communication skills are there by teaching communication skills. specific one failure leading to fear of failure, a vicious circle. And if there is a specific precipitating factor present, remove specific precipitating factor. In only a small number of individuals where, in fact, undue performance pressure and other areas where the intensive therapy is called for. So this is one of the important message what I'm trying to convey. All patients don't need all types of treatment. Myths and misconceptions. This actually you might have heard many times. I will not go into the too many details. Fantasy model. My partner should have been in this particular fashion. Anything less or anything more, in fact, I am not happy. Because this is what actually the Bollywood, the Hollywood, or Collywood and all actually these people. Many people are worried about whether they are muscular or not. And if I am not muscular, I am not. The penis related anxiety is extremely common. How big it should be, when actually it should be big, and how long it should be big, and a whole lot of such things. And people believe sex means it is actually, in fact, the penis determines what I am. These are a few of the common things. They are worried about size. They watch themselves and they actually lead to quite a bit of difficulty. They believe that it should spring like a tiger. And almost one has to understand that it is a master fear of hydraulics. Age itself can actually matters in a significant way. But more than anything else, being worried about it by watching, spectating, you are actually creating more problems. And the Dhat syndrome and other related things, actually the masturbation and actually leads to quite a bit of difficulty, very, very common. I mean, you are trying to talk about a premature ejaculation. This is one of the most common cause because it tries to control and more actually problem it actually leads to. Believe that almost like a coconut, you break the coconut means water gone and, but it has to be trained that it is like almost like wherein more water goes out and more actually water comes. So sex education becomes extremely important component. We had spoken earlier about female. They're worried about nose, lips, by each of the body parts, and everybody wants to be like what we basically call like a model. About the size of the breasts, they are very much worried. In fact, one of the cases I have documented, wherein a woman writes to me telling that she is having very good features, but still husband looks at other women who are having the bigger bust. Please give me some medications to increase the size. You imagine this particular lady, however big we make her breast, in fact, there may be other women actually who are actually having bigger breast size. Why actually the breast examination is necessary to rule out malignancy and related things what we are trying to talk about. About food, eating more, eating less, vegetarian, non-vegetarian, absolutely welcome. People are worried about presence of hymen or absence of weight and a whole lot of related aspects about actually we need to clarify. What is most important from the gynecologist point of view, the menstrual cycle. See, the women are highly arousable during what we basically call with onset of menses and somewhere in the mid-cycle. This may be the one actually the God intended. In fact, these are the two occasions wherein, in fact, the woman is highly responsive and unfortunately, they carry so much of myths and misconceptions related to the menstrual cycle and things like that can lead to quite a bit of difficulty. And ovulation time, and for that, in fact, you put up a whole lot of cycles, timetable and related things, which can lead to quite a bit of difficulty. So what actually I'm trying to tell you, the age appropriate, medically accurate, culturally competent education is absolutely necessary in the management of actually what we call the couple. When you are trying to talk about male sexual dysfunction, individual alone has come and individual related problems are some and couple related problems are some. In fact, each of these areas actually calls for a different type of management. Take an example, individual has come, he is having ED, you have evaluated and actually you prove that there are no other medical problems. If there is anything specific has been found, try to treat it. Improving libido, acquiring and maintaining erection, delaying ejaculation, they form. And depending upon whether they are psychologically sophisticated or not, whether pharmacologically you treat or combine with psychotherapeutic techniques, and how actually you go about whether nocturnal penile tumescence is present or not, or in fact the RIGI scan assessment, and only in a small number of individuals where you are planning certain extraordinary procedures where extraordinary tests are necessary. Otherwise, it is not necessary that anything is actually to be done in a very great way. Unconscious and other related mechanisms are extremely important. In fact, what we don't see, they are the factors which are actually maybe dominant. And when you are trying to talk about couple, there are predisposing factors, precipitating factors, and maintaining factors. I have labeled few things like childbirth, poor emotional intimacy, impaired self-image, predisposing factors like restrictive upbringing. Each of these type of things you have to look into and actually you have to plan treatment. I just added another about 3 to 4 slides to bring to the point See, man, once he starts thinking about one failure that happened earlier, he is likely to lose erection. Why? See, for example, to get the erection, I'll just run a little faster only. The message what I am trying to convey, to get an erection and then leading to ejaculation, the intracavernosal pressure should actually cross the what we call as the systemic pressure. To reach that, in fact, he has to keep all the other associated related problems extremely important. Otherwise, he's not likely to reach that particular. Primary and secondary hypogonadism. See, for example, somebody is having hypertension, somebody is having diabetes. Secondary hypogonadism is extremely common where testosterone replacement becomes necessary. In a woman, you have done a hysterectomy, total hysterectomy to a lot many other things. Each of these type of things carry very specific. In fact, hormone replacement therapies are extremely important. Where a desire problem is present, comorbid psychiatric disorders, comorbid medical disorders become extremely important, and that they have to be treated. And once you have improved the desire, the other therapies get into the picture. We are all well aware, man and woman, they are different. Women actually basically having less, in fact, interest in the sex too. In fact, man having too much of interest, where actually, in fact, we can try to read. There may be a couple where the woman is having more interest and the man having less interest. How actually it can be mediated. So communicate clearly, differentiate between invitation and demand, let sex simmer on low, rejecting an activity, not rejecting a person, employing art of compromise, avoid counting lovemaking, whole lot of such these things actually get into the picture, and intensive therapy sometimes where necessary. When you are trying to talk about treatment of erectile dysfunction, ED, we spoke about desire disorders. When you are talking about ED, identify and treat the curable causes of erection, lifestyle changes and risk factor modification, provide education and counseling to patients and partners. And almost all currently available clinical practice guidelines talk about first-line therapy as PDE5 inhibitors. Maybe about a decade ago or maybe 2 decades ago, we should talk about intracavernosal injections and things like that. See, there are different guidelines are available. Each one of them talks about PDE5 inhibitors, how they are important. In fact, this PDE5 enzymes can break down cyclic guanosine and prevented by what called as the inhibitor, and that's why the erection can be maintained. People have used short duration sildenafil, long duration tadalafil, and some few common side effects. And if you select it properly, hardly there are anything. Recommendations related to this whole lot of things, what we call international consultation has happened in this area. But what we have found in our clinical practice, all PDE5 inhibitors have an excellent efficacy and safety profile. No evidence that one PDE5 inhibitor is better than the another. Patients using different PDE5 inhibitors have similar perception of improvement after treatment. Direct comparative studies are lacking. Try different PDE5 inhibitors, almost like a la carte method. Dose titration, reach the maximum dose. Sildenafil citrate, almost up to 200 mg. Tadalafil, in fact, up to 40 milligrams. In fact, despite favorable clinical data, high dropout rates exist, and this particular universally available data indicates Western, Indian, or in fact, any country, this is one of the most common. How to select the best PDE5 inhibitor depending upon the partner's availability and lot many other things actually. So a proper specific pharmacokinetic understanding is necessary. Many of us are highly anxious about using PDE5 inhibitors. We are worried about heart attack, this, that, and absolutely none of these things are true. Prolonged, long-standing ultra-high dose abuse of sildenafil, what we case presented, he was using almost 1,200 to 1,400 milligrams per day for almost 3 years. Detailed evaluation, hardly anything major found. Many people don't respond, almost about 25%. It is actually failure to use adequate stimulation, adequate dose, adequate amount of time between taking medication and sexual intercourse. And one important, this particular slide, almost always I focus because if somebody takes PDE5 inhibitor and sleeps, maximum hairs on his head will stand up. So recounseling, concurrent diseases you tried it, concurrent hypogonadism we manage, and how actually one can use PDE5. In fact, counseling the patients, making them understand that fantasy, stimulation, mutual stimulation are extremely important steps in actually getting the erection. More frequent and regular dosing regimens with small dose, like say tadalafil 5 milligrams, 2.5 milligrams, 10 milligrams per day, absolutely fine. And when we are trying to talk about, this is one of the other paper what we presented, currently vortioxetine is in work for the usage. There are a whole range of antidepressants we were treating. Each one has certain specific problems. Currently, say for example, with those which act on 5-HT1A receptor systems, more particularly the vortioxetine has been found to be extremely useful medication. How to go about one single drug, we'll try to tell you. In fact, this is available as 5 milligrams, 10 milligrams, and 20 milligrams, except for gastrointestinal symptom problems, can be one of the very effective drugs. Vortioxetine, agomelatine, mirtazapam, these are a few of the other drugs which actually people have used in a very great way. Bupropion is another one drug which has been found to be useful. People have used a whole range of prosexual herbs, and more particularly those which acts on arginine and other related mechanisms. And the conclusion at this level, connecting the erectile dysfunction in the man, the range of drugs available which acts at the central level and peripheral level, those which act as initiators and conditioners, whole range of permutation combinations, where necessary, in fact, processes, and where necessary, in fact, vacuum erectors and such other things. But all of these things are possible. Ultimately, what I can say, of course, there are technically speaking, penile shock therapy, some few of those type of things. Lifestyle changes, physical activity, bringing about weight loss, in fact, whole lot of such related things. Psychotherapy, where necessary, problems are there. Pharmacotherapy, whether hormone replacement, PDE5 or Avimabine, penile self-injection and such other things actually still in vogue. Vacuum-assisted direction, surgery where necessary. This is actually the treatment for what we call as erectile dysfunction. I think I have another about 15 minutes time available.
Yeah, no, sir, no, you can proceed. No issue about time. You take whatever time you want. No problem, sir.
Okay, so kind. Thank you. The other one is actually what we call premature ejaculation. Extremely common. In fact, people believe that half of the population is having this premature ejaculation or early ejaculation. All population can be divided into those who are early ejaculators and those who are not. This much only the issue. Extremely common and leads to a whole lot of difficulty. See, you look at premature ejaculation is at one spectrum where there is no documented organicity at all. You talk about retrograde ejaculation, anejaculation, delayed ejaculation, one or other organic factor actually present. So this particular differentiation you should remember. If somebody has come to you and he says that he is having early ejaculation, you have to be very clear that this particular fellow is not suffering from any major disorder. It is one of the psychological problem. It is an anxiety related problem. It is actually a learned conditioned problem. What are the issues with these fellows? They have a very less ejaculatory latency. They don't have control over ejaculation. And that leads to what we call as problems in sexual satisfaction. People have believed that less than 1 minute is actually the DSM system now currently talks about. Earlier, we used to talk about number of strokes, the 1 minute, 2 minutes, 3 minutes, 5 minutes, a whole lot of such actually terminologies came into being. There are actually 4 types people have documented. If somebody gives a gap, likely to ejaculate early. So lifelong acquired, these are the 2 extremely common these things. Natural variable, because of the availability of the partner or absence of his ideas related to the masturbation and on, in fact, can actually impact on what actually the degree of ejaculatory frequency. Premature like ejaculatory dysfunction is extremely common, and this is what actually which contributed to almost 30% of the population having premature ejaculation on some of the earlier epidemiological studies. Every man believes that he should have delayed little more longer. He should have been actually lucky that particular way. And these are all few of the things. And all those antidepressants, what we use for a depression, they're all quite effective drugs for premature ejaculation also. One of the highest blocker currently available is actually paroxetine. But you have to be a little careful. Paroxetine is available as 12.5, 25, in that particular range. If you give a little higher dosage, it can act like what we call a nitric oxide synthase inhibitor, because of which the erectile problem can come up. So for each of these drugs, you should be aware of how much to give. Don't look at, so there are about 30 antidepressants may be available. You forget about all the things. When you are using paroxetine, maybe what actually many people need is 6.25 to maybe 12.5 milligrams. Maybe many of the people actually sufficient. This is one very well-known sedative also. It can control anxiety very significant way. Sertraline, 25 milligrams to 50 milligrams. Fluoxetine, 10 milligrams to 20 milligrams. These are all 3 drugs, if you remember, that is fair enough. Some of the psychiatrists, psychologists were there. Fluoxamine. In fact, this is one of the least among SSRIs. sexual difficulty, available as 25, 50 milligrams. In fact, one can control many of the problems. Maybe daily usage or online demand usage. Actually, these are the two things. See, Depoxetin acts only for about 3 to 4 hours. People have tried to use that particular way. Or we all believe that, in fact, premature ejaculation is part of the anxiety spectrum disorder. So controlling anxiety with specific antidepressants is actually one of the extremely important ways to handle it. So Depoxetin you use or one of the SSRIs you use, extremely important that you have a proper knowledge about pharmacodynamics of these drugs. And once you start doing it repeatedly, maybe about 5-10 patients, you will become more confident about these things. Techniques, non-pharmacological, whole lot of things are there. I'll not go into detail here because we'll be elaborating on them. So how to do the treatment of premature ejaculation? Rule out organicity in the sense that if there is anything other related problems, primarily establish what is his anxiety and other related things. Try to treat, say for example, depression, anxiety, phobias, and such other things what he has properly with drugs. And those particular drugs can be therapeutically used by adjusting the dosage in such a way that problem can be controlled very easily. Some people may need behavior therapy in combination. So this is what actually we talk about. When you are trying to talk about females, the treatment is actually something totally different. In fact, none of these drugs what we are talking about men is likely to work in case of females. When you are using couple, this is what actually I'm going to talk about to you now. This intensive therapy, extremely important. So about this, we have spoken already in great detail about sensate focus exercises, and you can go back to that particular video, and that will give you a great detail what are the things. So implicit that earlier 3 steps easy for anybody. Intensive 3 depends upon your knowledge, time available, competence, and your will to actually treat this individual. Patient's motivation to get well. Many problems which cannot be solved through brief therapy, they can be treated by interpersonal conflict eradication, erectile dysfunction management, premature ejaculation, desire and orgasm problems, and they could be referred to marriage counselor and sex therapist where necessary. Or if you spend a little time, you learn some of these things, it becomes easy. How you go about? Intensive therapy, not necessary for everybody we have mentioned. Those who have motivation, those who are willing to undergo treatment, in fact, these are the people for this. And when you are trying to talk about female problems, this is extremely important. And couple problems, couple therapy, when you are trying to talk about, these are all the steps which are necessary. So initiate session as couple. Maybe the initial interview separately, combining together. In fact, reworking some of the things what they have told in the individual sessions. Rule out organicity, any other medication factors, assess the motivation, and these are all extremely important preliminary steps. Proscribe sex. You must ask them to stop sex. This is because this is already generating problem, and to overcome it, first getting out of that particular anxiety that he has to perform can be one of the very, very rewarding experience for both the people. And this particular instruction should come from you. Wife telling him not to have sex because that's what doctor has told, or a patient telling male to the partner that this is what doctor has advised, not applicable at all. This instruction should come from you to both from your side. Multiple sessions are necessary, maybe 10, 25, depending upon the case. The couple feedback session will tell you how actually want to go about. Starting from very simple step to actually you move is one of the very important step. What all the drugs which work in case of males, the same physiology, same biochemistry, but it still doesn't work in case of female. And many females are left high and dry because man, once he has ejaculation, turns and slips off. How you would like if someone turned you on and then left is one of the very common complaint from many women. Female sexuality in general, it is inhibited female sexuality. And about this, actually, we have already given 1 or 2 sessions earlier. This is one of the very common thing that woman almost always under lock and key, because unless she feels comfortable with the relationship, she is not likely to open up. Second, erectile tissue is distributed at one particular point in case of male. But in case of female, far and wide, unless she closes and concentrates, it is not possible for her to get aroused. And this is what actually leads to quite a bit of difficulty. So penetrative, relational, participative, recreational, these are all different terminologies people have used. They are all extremely important steps in our actually management, more particularly. This I have already spoken. Intimacy issues are extremely important that need to be attended. Those couple who are having positive regards for the partner, very easy. Those who are fighting, it is possible. Those who have stopped talking and they are living separately or they in separate rooms, very, very difficult to treat. So extremely important to be aware of. Sensuality issues. But keeping oneself actually interesting for the partner is a very important step. I have given an example of one of the couple who came and told, sir, I don't like her because she will be always dressed shabbily, doesn't take bath every day. I get put off. When this particular issue came for discussion, wife's comment was, I am his wife, not girlfriend. That means you are not girlfriend or you are already married. That means everything is settled. It won't happen that particular way. The arousal, the sensual aspects are extremely important. And the third one, when you are trying to talk about female sexuality or couple sexuality, the orgasm depends on oxytocin, not on the other purely other related things what we used to talk earlier, estrogen, testosterone, progesterone. They are also important, but oxytocin is actually extremely important step for orgasm. The initial romantic situation where you feel hot is attributed to the oxytocin effect. And the marriage, which actually brings in so many difficulties, issues, in fact, that actually wipes off that particular oxytocin effect to a great extent. To get that oxytocin effect, treating the partner as girlfriend, sustaining the interesting things are extremely important. So when we are trying to talk about female sexuality, it is touch and touch alone that actually matters. And this is one of the reasons why the sensate focus exercises such as the things are extremely important. In almost about 29-30% of the women, intercourse situation can bring satisfaction. With fantasy alone, this example I have given earlier, Indian women in particular, you ask them to fantasizing about the same husband, wearing this, wearing that, and other related things. In fact, it is not arousable at all. Men are extremely great as far as this particular aspect is concerned. And with vibrators, almost about 100% of the women can be taken for orgasm. And when you are trying to talk about inhibited female sexuality, it is making women understand her body responses, the sensitivity, and in masturbation. In fact, in the gist, I can tell you at this particular level, and somehow when we have done studies on almost about 500 plus women, what we found was that only around 32% of the women reported masturbation sometime, and only about 12% of the women reported being comfortable. And many women actually get into the difficulty because, in fact, men don't express, they don't share, and they don't listen, they don't understand what I give instruction. Primarily, they think in terms of sex means actually purely physical nut and bolt phenomenon. These are all repeated emphasis complaints made by the female partners. So sex therapy, when we are trying to talk about, they are not nude marathons. Men in white coat watching you make love, touchy-feely sessions, and where training is necessary, how actually you can understand each of these principles and try to manage. And when we are trying to talk about premature ejaculation, it is very easily, almost about 100% of the people can be managed comfortably. Erectile dysfunction, almost around 70-80% of the people, in fact, can be successfully treated by what we basically call these MJ techniques or Marston-Johnson techniques. And some modifications we have done, keeping in our socio-cultural relationship aspect in the mind. So first step is actually communication and relationship improvement related to this. And whatever simple problems to complicated problems. This we have discussed earlier in communication section. Each of these type of things you need to attend. Touch is one of the extremely important component, and this is what the whole sensate focus exercises are all about. And this we have actually spoken to you in great detail in what we call communication section, and how one can go about, in fact, self-awareness physical. In fact, individual tries to understand what actually the sensation gives me pleasure. Watching our own genitals, in fact, making feel comfortable about it, using words, being comfortable about it, and participating it, in fact, being comfortable about it, it is actually one of the training process. Nowadays, in the movies and all, people have documented how actually the masturbation by a woman, including using of vibrators and all, in fact, it is very famous in the movie, how you go about making her understand, appreciate her body, from all angles, and actually, in fact, touching, finding it important, what actually stimulating is one of the important steps. Sensate focus, couple learns how to touch and be touched without worrying about performing or reaching the goal. One of the videos we had spoken earlier about what is the sensate focus about. Shall I replay it again, or because we have spoken earlier, shall I just skip it?
Yeah, you can skip it, sir.
So ultimately, what the purpose is to provide a structured approach which allows the couple to rebuild physical intimacy and gradually rebuild their sexual relationship. To identify the specific maintaining factors, to provide specific techniques for managing this one. Give clear instructions, ask about anticipated difficulties, obtain detailed feedback. Majority of these steps are necessary. So principles is just as important as learning what your partner likes is learning what you like about your partner. Taking turn exploring, pleasing each other and yourself during these exercises. Finding out where you want your sexual partner, what part of his or body, particularly what fantasies delights you. When you are being explored, don't try to influence your partner with directions and requests. There may be little issues related to this. Wait until they know what they like and then tell and show what you like. No intercourse. And this comes as one of the last steps. Different steps actually. In fact, the whole schedule, non-demand sexual stimulation of the partner. And for, say, for example, different individuals have different problems. This is equally applicable for erectile dysfunction. How to stimulate, stop, start. In fact, majority of these techniques, in fact, how to learn. In fact, the coronal area, anterior posteriorly giving pressure, one can stop. And this could be very effective method even in case of premature ejaculation. Sensate focus without genital contact, with genital contact, with mutual stimulation, with the genital contact and simultaneous caresses, vaginal containment movement. This is the way it runs. Why female superior position? Because she can be under control. Men usually, they lose control once some particular stimulation goes in a particular way. You can combine certain drugs, female Viagra like flibanserin to, in fact, benbonatide. If somebody asks the question, I'll try to talk about. So in conclusion, related to the management of female dysfunction, lifestyle changes just to be mentioned in case of male, counseling. The most important step is actually the what we basically call relief for her from her day-to-day drudgery. I can give you an example of one of these IT fellows, this couple, both are software engineers. They have to go to Bangalore and she gets up very early morning, gets ready with the food and everything prepared, goes to the office, comes back around 7 or 8 o'clock and then prepares food. Joint family, everything given responsibility. She's so exhausted. So in fact, here the treatment is actually making her free. In fact, keeping a cook or somebody to help her in day-to-day work would actually solve all the problems. So these are all a few important things you should keep in your mind. And you are all well aware as gynecologists, the role of lubricants and moisturizers and physiotherapy and how they are actually important. So carry home message. Go back to the clinical practice guidelines that are available, which can help you in a big way. Remember that sex therapy means not giving a drug or some procedure which done everything taken care of. It is actually the managing relationship. Myths and misconceptions are there. Anxiety generating issues are there, you remove. Make use of biopsychosocial model.
Coffee. Nikki, Sunday. In the plan.
இன்னைக்கு சண்டே இல்ல, நாள் தானே லீவ் கிடைக்குது, கொஞ்சம் விட.
சாப்பாடு நல்லா இருக்கா?
சூப்பர். இல்ல, ஒய்ஃப் நம்ம கிறுக்கிட்டு இருக்கா.
The message I was trying to convey, that relationship building it extremely important step. Each case may be little different. One has to be very careful about all these aspects. We can make the individual up to his basic level, and this I have already mentioned. There are relatives and other, once they are involved, many of the times we have not succeeded in actually managing some of the cases. Unfortunately, in our country, when you are trying to talk about sex therapy,
marriage is a one-time admission for a lifetime education, where your graduation day will never come. So if you're married, okay, be married and be happy. If you're not married, me unmarried and very happy. The choice is yours. But if you're married, every day it is a new experience with the same person. You're married to a girl and she became a wife. And once you're married to a wife, you're not only marrying to one girl, you're marrying to the integrated package. In-laws, mother, father. Only then you will know, oh my God, just because I love her, I need to pretend like loving everybody. Instead of pretending like loving everybody, it is better not to love her only. The same with her. The same with the woman also. But no other choice. You need to get into this marriage game. Because from the first day till the last day of your birth, you can never find a person who is going to think in a way you want. Even if you find them, you will never find a single person who will talk to you in a way you want them to talk. Even if they talk in the same way you want them to talk, they will never think only good thing for you. Not possible. The only person who is available to think good about your own self and talk good about your own self all the time is just you. But the game that you're missing here is the mother and father has done enough to you to make you rise. The society has done enough to you. And above all, the universe will never feel enough how much you're ready to give, but you're not understanding what you're supposed to do. You want your loved one to be happy. There is no second intention, but you're missing the fundamental requirement. When you're not happy, they cannot get happiness from you. Even though you don't want them to be happy, literally you're not bothered about anybody. But when you're happy, whoever is coming in contact with you, they will be. So what is the real requirement to make them happy? Enjoy your relationship. Be happy with them. And to be happy with them, the first thing you need to do is what? You be happy.
nobody will get a perfect wife or a perfect husband. In fact, we have to convert them. When you are doing sex therapy, in fact, particularly women, we have seen, in fact, they're worried about so many other related things, unrelated things. It almost becomes very difficult to carry out. Bring the magic of actually bring the two people together. Whatever you want to tell them in proper words, and in fact, extremely important. Even from a therapist point of view, you just cannot assume that she understood a lot of things. A girl doesn't look for six packs in men. Pure is cuddled. And very important, now the technology has entered the bedroom. The mobile, or in fact, computers, TVs can create quite a bit of difficulty. Excellent performance comes from the excellent mood, and partner is the best. People go for what we basically call aphrodisiacs. When nothing works, it may have a role to play. another one small video, and I think whether I played it earlier, I'm not sure.
Really? God. No, babe. Really, God. No, babe. Only on Radio Virgin 98.3 FM. It's on.
Hello. Hi, is that Mrs. Mahajan?
Yeah.
मिसेस महाजन, मैं पटेल बोल रहा हूँ। आपके हस्बैंड साहिल महाजन मेरे सामने बैठे हुए हैं। मैं आपसे कुछ बात करना चाह रहा था।
ये खुद क्यों नहीं बात कर रहे हैं?
नहीं, मैं आपसे बात करना चाह रहा था। मैं आप
बैठे हैं ना सजे हुए, अब ये आप ही से बात कर ले। मुझसे तो बात करने की जरूरत ही नहीं है इनको।
नहीं, मैं आपसे बात करना चाह रहा था। मैं ये कह रहा था कि
चाहिए तो ये सजे हुए वहां बैठे हैं ना, अब आप ही से बात कर ले। ये जो अगर हमारी अब बात खराब हो रही है ना, इसकी जिम्मेदार ये खुद है। और ये जो आपको अपना हमदर्द समझ रहे हैं ना, इनसे कह दीजिए कि अब अगर इन्होंने मुझसे जिंदगी में भी कभी बात करने की कोशिश की तो मैं इनसे बात नहीं करूंगी। सुबह से तो फोन करने का टाइम है नहीं इनके पास। कोई बात करने के लिए माफी मांगना कुछ नहीं, वो भी आपसे फोन कराने, और तब भी खुद बात नहीं कर रहे। वहां बैठ के क्या बुतबन की क्या कर रहे हैं?
मैं ये कह रहा था आपसे,
बिल्कुल खुद की गलती, सुबह से खुद ही मुंह फुला के बैठे हैं और ये बहुत पछताएंगे। इन्हें पता नहीं है। आने दो, मैं भी देखती हूँ कब तक बात नहीं करेंगे और कब तक ये ड्रामा चलता रहेगा आखिर।
नहीं मिसेस महाजन, मैं इतना
होश नहीं है कि जब सुबह निकल रहे थे कम से कम तभी कहते थे कि अब बात को खत्म कर दो, रात गई बात गई, लेकिन नहीं।
आपसे तो ये है कि
कहाँ बैठे हैं ये रात साहब?
अभी तो वॉशरूम गए हुए हैं।
जब ये आ जाए ना वॉशरूम से, इन्हें कह देना मुझसे बात करने की कोई जरूरत नहीं है।
आप भी थोड़ा सा सिचुएशन को कभी मतलब
आप मुझे क्यों समझा रहे हैं? आप कौन होते हैं आप बोलने वाले?
मिसेस महाजन, मैं कौन होता हूँ? मैं सन ज्वेलर से सेल्समैन हूँ। अभी उन्होंने डायमंड रिंग चूज करी है, वो आपके लिए उन्होंने डायमंड रिंग चूज करी है, तो वो कंफ्यूज थे कि रूबी पर्ल डायमंड इसमें कौन सा ज्यादा, मैं कौन सी वाली इनको दूं, तो कह रहे थे आपसे पूछ लें आपको क्या पसंद है।
डायमंड अनकट है क्या?
आप कहेंगे तो अनकट रखेंगे इसमें, आप कहेंगे तो रूबी रखेंगे ज्यादा।
नहीं, आप अनकट ही रखिए, मुझे रूबी ज्यादा पसंद नहीं है। बस ध्यान रखिएगा कि वो थोड़ा सा शार्प हो। पर्ल्स ब्लू लगाएं।
नहीं, पर्ल्स तो उन्होंने ब्लू ही बोले। अब तो पैक कर रहा हूँ। हाँ ठीक है, मैं इनको यस।
साहिल कहाँ है?
आ गए हैं, टॉयलेट से आ गए हैं।
बात करा दीजिए।
हाँ नताशा। हाँ बोलो।
कैसे हो?
ठीक हूँ।
अच्छा सुनो,
बोलो।
आई लव यू। घर आ जाओ।
The point is absolutely necessary that sometimes the money, position, power, they are highly aphrodisiacs and they are all important role play in the individual's life. This is another small video. After that, we'll be closing it. But okay, 1 minute.
A female is designed by God to receive. And whatever she receives, she incubates, multiplies it, and gives it back to the male. She was built to do that. So whatever you give a woman, she'll receive it, multiply it, and give it back to you. Whatever you give a woman, are you listening, brothers? She'll never give you back what you gave her. She'll multiply it first. She's designed that way. If you give a woman a sperm, you'll never get a sperm back. She'll multiply it, give you a baby. If you give her a house, she'll multiply it, give you a home. If you give her groceries, she'll give you a meal. If you give her frustration, she'll multiply it. Yeah. So, brothers, if you don't like what you are getting, change what you're giving.
Beautiful words. In fact, each of the steps, in fact, even the saree is an extension of the woman's body. And I think this is the last video.
कॉफी।
थैंक्स। क्या हुआ?
गाड़ी बीच रास्ते में खराब हो गई, पैदल चल के आना पड़ा।
कहा तो ठीक है ना।
A few moments later.
to be able to give pleasure to a beloved person, at the same time receive it, is a unique experience, and this can seem like a small miracle. With these few words, it is extremely important that if you never try, you will never succeed. You have to start working on that. I'll give you a small example. See, for example, when we talk about sex therapy, invariably we are talking about so many technical terms. There was one patient who came and told me he's having both ED and PE, a Malayali, and read a lot of these sexual issues. He told me he's having both ED and PE. I was a little curious to know what actually he's trying to tell. The story is like this. He closes the shop around 7 o'clock, goes to his girlfriend's house. He has premature ejaculation. Goes home, after dinner, he tries to have sex. He was unable to perform. What we did was modifying his timetable. He goes to the house straight, and in fact, he was able to perform morning while coming to the shop. He can visit his girlfriend. His early ejaculation came under control. So what I am trying to tell you, a simple little bit of adjustment, that means a very proper way of looking into the whole problem, is one of the extremely important. Formula for sexual fitness: regular sex and frequency, touch, diversify from genital to sex, and that's what actually gives immense pleasure in the whole relationship. Use your imagination and fantasy. Diet, exercise are extremely important. Capitalize on your assets. Stress reduction techniques, smoking, alcohol, better to be avoided, so also the sex offender drugs, and professional help where necessary. There are plenty of publications are available. If somebody interested, the soft copies, I can send it. If you can send it to either tssrav19@yahoo.com or gmail.com. And we have some training programs, and we are extremely happy. Manish Mahajan is very, very actively enrolled quite a few people in this current year. Thank you very, very much for very patient hearing. And I'm grateful to Foxy in general for the wonderful opportunity what you have provided for me to interact. Pretty length of time I have spoken, and I'm really grateful that you have such extraordinary patience to listen to what was actually being told. Thank you very, very much.
Thank you, sir.
Thank you, sir.
It was a very marvelous presentation. We can go on and on listening to you. So it's like that. So we never get bored when listening to you. So you make a presentation in such a way with your so beautiful videos. It is always great to learn with the fun. Over to you, Manish and Apurva. Is there any question in chat box you can take up? Apurva, Manish, unmute yourself.
Yes, sir. Yes, sir. So there is no question in the chat box.
And few questions were there. Manish, few questions were there in chat box. Just go through it.
No, sir, I couldn't see any question.
A male patient came to me and said, I have the best and longest orgasm by masturbation alone. Why should I sleep with my wife? See, the masturbation is one of the best possible response an individual will get. Fortunately, unfortunately, you have to marry, and when you are married, there is a particular responsibility involved. Managing wife is actually involves quite a bit of energy and effort. It means is investment on the relationship, investment on emotions, investment on many things. But masturbation doesn't involve any one of those type of things. This is one of the reasons why masturbation is easy, masturbation is convenient, masturbation involves a lot of relief for many individuals. And they continue to carry forward this particular process. When we are trying to talk about sex therapy, there is a problem in the relationship and how best it can be done. If you are alone, you are not married, and masturbation alone is giving to satisfaction to you, absolutely fine. In fact, with the life, there is no other way one can think on that.
Manish, there is one question about Kama Sutra. Sir, do you think our own Kama Sutra has a role to play in the present sex therapy?
Yeah, absolutely. In fact, many of the things what we are trying to, in fact, Master and Johnson's therapy, or subsequently what we are trying to talk about many other therapies, majority of the concepts are derived from Kama Sutra. And when I'm trying to talk about relationship, intimacy, sensuality, and all of that, these are all Kama Sutra items.
Okay.
Unfortunately, we are behind the Western model, and that's the way we actually try to look into the whole issue as though they have contributed. In fact, it is said that In fact, some of the concepts what Marston Johnson incorporated are derived from Kama Sutra concepts also. In fact, Dr. Rajabrahmamurthy Vijay, in fact, he speaks very elaborately, eloquently on that particular thing. And you must put up a lecture by Dr. Rajabrahmamurthy for that.
On 23rd, we have a lecture on Kama Sutra.
So how actually Kama Sutra benefits, and all these concepts are already ingrained there, which we are making use of in different names. Mindfulness is another area. In fact, in this particular this thing, I'm seeing one person by name Manoj Pandey. In fact, he is practicing this mindfulness concepts in a very big way, and he can definitely speak on some of these type of things in a very big way. This is all how we actually incorporate. Somehow, unfortunately, I forgot to use that word mindfulness, but this is part and parcel of therapies.
And there was one question from Dr. Nikhil Patel. Manish, can you elaborate that question?
Sir, unfortunately, I cannot see the question.
Okay,
in the
so
chat box.
let me put up the question. Sir, can you please elaborate more on the mature defense called sublimation?
1 minute.
Elaborate more on the mature defense called sublimation.
See, the point is, there are few defense mechanisms which are actually quite useful for almost majority of our life in general, of our relationship issues in particular. One important mature concept, in fact, the laughter. In fact, I earlier used to get upset when my wife scolds me. Now I know that she scolds for 15 minutes. I enjoy what she scolded 15 minutes. That scolding itself can be one of the very pleasurable activity. In fact, how nicely she scolds, how musically she scolds, good enough. Now she scolded half an hour, fair enough. No, you got the point. Changing the attitude. In fact, a lot of other activities, getting engaged with certain things which actually don't bring about major conflicts with the society. Altruism, in fact, being helpful to others. Like this way, there are mature defense mechanisms which are there, quite beneficial. In fact, Dr. Manoj Pandey, you want to tell 1 or 2 words about mature defense mechanisms, Manoj?
Sir, am I audible?
Yes, you are audible.
Yes. I think Neeraj sir has asked about the sublimation, if I am not wrong.
Yes.
So for that, I will give a classical example of our greatest epic writer Tulsidas. There has been a saying that once he was in love with his wife, and unfortunately he was not able to meet to her. So he went through the window, and I think it is a saying, but the truthfulness behind it is in question mark. Then the roof through which he went to his room, to her room through the window, was a snake. And then after then something happened, and his sexual desires and all those things has converted into the writing, and he started writing the great epic. So basically what happens that, suppose again I would give one more example. I am very much interested in the sex, and my super ego is putting the censorship on it. Then my ego will develop the mechanism that I will write the books about the sex. Somewhere in my unconscious, I am getting the pleasure by writing the books about the sex, which is acceptable to the society, rather than my direct sexual encounters, which my id is forcing to me. So that is the example of the sublimation.
Okay.
Yes.
Thank you. Apurva? Manish, are you there?
Yes, sir.
Yeah.
There is
So
a question called sex phobia.
Yeah.
Entity called sex phobia. See, earlier this used to be grouped under what we call as sexual aversion disorder.
yes.
Now, because it is a phobia, now it is grouped under a section called phobic disorders. It is there, except that the section under which it was dealt has been actually modified.
Right.
Or onions and garlic aphrodisiac. In fact, they are quite healthy and useful, But only thing is you eat onions and try to have sex means the partner may be put off. These are all few of the things you have to remember. Each of this type of things have the contextual and other related factors in operation. Sir Krishna here, perfect to be honest when you used to tell us as huge is. In fact, I think he was my student, I think. Krishna Surendran. We never understood then, and everything falls in place now. Actually, I can make out. Beautiful. In fact, it is a good learning experience.
So, Apurva, are you there?
Want to know the training in sexual medicine? See, currently, so for example, the different small type of programs. For example, Foxy had one certificate course. IMA has certain programs and all of that. But one university-based comprehensive program currently, as it now, is available with JSS Academy of Higher Education and Research. We have two programs. One is fellowship and other one is certificate course. Fellowship for 1 year and certificate course for 6 months as it stands now. But we are permitting them all through the year. One for medical and other medical plus non-medical, depending upon the convenience and other related things. In fact, for all practical purpose now, though it is called as a dual mode, it will be primarily online with the limited physical training programs. Manish is a part of this particular program, and he can give independently experience related to that.
Yeah, thank you, sir. Manish, now you can wind up with the vote of thanks.
Yes, sir.
Apurva, are you there? You can.
Yes, sir. I'm here, sir.
Yeah, I was asking. So you
Should I proceed to vote of thanks?
Yes.
Okay. So really, after this awesomely wonderful session, and really I can say it's an eye-opener session by none other than but our TSS Rao sir. It's the time to say goodbye. So before say goodbye, I would like to thanks to none other than but President Foxy, Dr. Rishikesh Pai sir, our Secretary General, Dr. Madhuri Patel Madam, Vice President in charge, Dr. Asa Bakshi Madam, our own chairperson, and without him, this can't be possible, Dr. Neeraj Jadhav sir, today's chief guest, Dr. Alpesh Gandhi sir, the guest of honor, Dr. Parag Viliwale sir, and our Dr. Ashok Kumar sir, and the man of the instant, the man of the of all the TSS Rao sir for the wonderful lecture, and my co-moderator Dr. Manish Mahajan sir. I thanks all of you. I thanks ICOG chairperson Dr. Lakshmi Shrikhande Madam and Secretary General of the ICOG Dr. Ashok Kumar sir for giving us one ICOG credit point. I also like to thanks to all the delegates who joined, and they are stick to the screen even after it's 2.5 hours, and they are actually have a wonderful discussion, wonderful interaction with our faculty. Thank you so much to all of you, and thank you so much.
Yeah, Dr. Manoj, you want to say something? Yeah.
Yes. Dr. Rao sir had talked about the mindfulness.
Yes.
I would like to have few sessions on that, and along with that, now the world about the psychiatry and psychology is going to be changed. There is a huge development in the West about the trauma-focused approaches. Basically, the trauma-focused approaches are looking at the psychiatric and physical illnesses also, and they are finding the great association between the physical and psychological illnesses to the traumas the individual has gone throughout the life time. That's why the WHO has also included one new diagnostic guideline in ICD-11, that is the complex PTSD, which was not there earlier. So basically, I would like to talk about that, how trauma can lead to the sexual problems and how we can address to treat them. So that would be one of the another area of interest which I would be talking about with the permission of the chair, and I'm very happy to be associated with the association. Obviously, my salute will be going towards my dear sir, and who is my colleague there also in our hospital. And really, Rao sir is always evergreen and great. because
Sure,
he is the person who made me acquainted with this association, and I try my best to be there in all the programs, and that is the also what I wanted to say. Thank you so much.
Sure,
Sir.
sure. We will do something about that, about
Yes, yes,
mindfulness.
yes.
We will take one session. Okay.
Yes, sure, sir. Thank you.
Thank you, everyone, and good night and bye from the Sexual Medicine Committee, Foxy.
Thank you, sir.
Yeah, good night, everyone.
Thank you very much.